Now this, a disturbing development in medical news. Whooping cough cases in the U.S. now hitting their highest level in a decade. Let's bring in New York City physician Dr. Devi. Thank you so much for being here, doctor. What's causing this? I mean, this is, the highest in a decade. That's something.
Yeah, so there's probably a few different reasons. I mean, one thing is that because there's so much coughing and stuff, our tests have gotten better, so people are getting tested more often. Doctors are looking for it. But it's probably a few more factors. So, first, we're coming out of the lockdowns, COVID. These past couple of years, we've had many more gatherings. And, typically whooping cough, it has these spikes or these cycles every 3 to 5 years. So we were due for one during COVID, but we might have missed it because of the lockdowns. And now, as people are gathering more, we're seeing that cyclical trend. Another factor is that, we've had a change in the vaccine back in the 90s. We used to have a very strong pertussis vaccine. That's the other name for it. It was very strong, so it was good in terms of controlling whooping cough, but it also had a lot of side effects for the same reason. So what happened was that as it got better controlled, the vaccine changed into something that was a little bit weaker in the sense that it doesn't last as long. So for that reason, if people didn't get vaccinated during COVID and the lockdowns, if they were delayed in getting care, what could happen is that the immunity kind of faded or waned. And so now people are more at risk to get whooping cough and to have more of the complications. So, and then we can also add that all of these kind of infectious diseases, they can have mutations, so they can spread more easily over time. But it's probably a combination of those factors. And then when we also think about vaccines in general, obviously after COVID and the lockdowns, some folks are a little bit more hesitant to get vaccines or have held off. So that can be a factor. And then we have illegal migration, so we can have people coming in who are unvaccinated.
Here are some of the symptoms that people have to worry about. The whooping cough cases get worse with time. So that's another complicating factor here. The early symptoms are a low-grade fever, runny nose, mild cough, but then later comes the violent coughing fits, vomiting, sleep apnea, pauses in breathing, basically, which is why this is so dangerous for little kids. And there were more than 32,000 cases in the U.S. this year, 6 times higher than just last year. So what can people do to protect themselves?
Yeah, so this can be very stressful, whether you're the person who has the cough or if you're sitting across from someone who has a cough, especially during these holiday get-togethers. The thing is, because it has a long period of contagiousness and it's very contagious, if you have any cough or cold symptoms, doesn't even have to be the cough, but cold symptoms, you may want to hold off on going to some of these get-togethers because it still could be pertussis. The reason it's called whooping cough, though, is if a person has this sort of gasping for air after they've been coughing, that's particularly concerning. And if you have these symptoms, I usually recommend that people call 911 or call the urgent care before going there, because since it's so contagious, if you go there, then the other people there might be at risk of catching it too. And if it's not whooping cough, even if it's not, anybody who has chest pain, difficulty breathing, any kind of fever, better to get checked out to make sure you don't have another problem. Yeah. But just to reassure folks, if you see someone who has cough, it doesn't mean that they automatically have whooping cough. It could be something else. People can have acid reflux at this time. You have asthmatics and COPD, post-infectious cough, like where people are recovering. So
it's that season, it's the season for coughing, unfortunately. Want to get to one other topic very quickly before we run out of time. This weight loss drug, Zepbound, just got FDA approval to be used for sleep apnea. So my question to you is, because obesity has so many impacts on overall health, do you see some of these weight loss medications being approved for more and more conditions?
Oh, yes. I mean, I think that's the future. I see it's not approved for it, but I treat a lot of patients with arthritis and with other complications of obesity, and they seem to be getting better as they lose weight from these medications from other causes. So I think the whole landscape of medicine may change over time.
Interesting times ahead, and really a lot of breakthroughs in medicine these days. Dr. Devi, thank you very much for being here. Appreciate it. Merry Christmas.
Merry Christmas.
Rich.
Jackie, sanctuary